Gladys Berejiklian, Kerry, Chant, thanks for your time. I feel like I'm interviewing the two women who saved New South Wales, at least for the time being, and the Australian economy. I mean, what would you say to that?
I'd say our efforts in New South Wales have been very much a team effort, backed in by outstanding public health officials led by Dr. Chant, but also a whole of government governance structure, Andrew, and I can't stress that enough. Contact tracing is critical, it's important, but it's only part of the picture, part of the story, and if you rely just on that and not on all the other things that need to happen, you won't succeed.
Well, what do you mean by that? What sort of things?
Well, obviously, testing rates, getting the public on board, the compliance that police are managing, the logistics, this centre, which has 20 government, federal and state agencies working together, Service New South Wales, who rely on supporting health and getting that real-time information out, and the digitisation processes. We have real-time information going out to people as it emerges, and again, it's a whole-of-government approach, and if we didn't take that approach, if we didn't set up this State Emergency Operations Centre back in February, March, we wouldn't be where we are. But I have to say, we can't rest on our laurels. This could go belly up any day because it's an extremely contagious virus. You're relying on people who've been at it for 8 months, and I worry about fatigue and other things. So you can't be complacent for a single day, but you also can't assume it's one thing. It's actually several things coming together in the right way. Okay,
well, Kerry, Chant, what is it about the contact tracing system that has helped? How many troops do you have involved in it? How have you got the testing results coming back so quickly?
I think I'd just like to echo first the Premier's comment that it's ultimately very much a team effort, and it's how all the multiple cogs work together seamlessly. So the first thing is we need to get the community on board to get tested, and we need to make testing easy. So we've done that by we've got a centralised pathology service, New South Wales Health Pathology, and we've worked also from an early stage with the private pathology providers to provide that multiple points of entry. We've worked with the community to get them to come forward for testing, and we've done this rapid turnaround test results. So generally, early on we were constrained with our testing capabilities. We grew that through the work of New South Wales Health Pathology and our work with the privates. We therefore can do things like text messaging the results, and in general we're getting results back in around 24 hours. In some cases longer. We've also invested in faster testing capability in our regional areas because often the delays were bringing the specimens into the centre. So again, having increased testing options available regionally. We've then got our decentralised public health system, which is embedded in our area health service. And I think that structure has been a success because no one knows your local community better than people that live and work in that local community. So that's been able to get that engagement locally, but it's also meant that we can rapidly connect our responses. So for instance, if we know there's a cluster here, we can immediately stand up a testing clinic. We've then got the contact tracers and the investigative staff, and that's been built over many years in terms of the decentralised public health model with a strong core. We've also invested in electronic notifications and an NSIMS database, which is got connected across the state. So some of these are the sort of people that have come before me have built up some of these systems that really put us in a good position when we're dealing with a challenge like the COVID pandemic has presented us.
So the pandemic comes along. This is something you've planned for years in your job?
I think it's important that the systems have been practiced for times when we've responded to measles outbreaks, foodborne disease outbreaks, and so some of the core elements we have built on. And I think that's important, that it's important that you invest in times outside the pandemic. The more business as usual systems, the more connectivity in whole of government, it means that it's a seamless transition to scale up. It's still very challenging, and can I tell you that we've had to bring staff on board, we've had to scale up, our systems have been stretched, so let me not mislead the community that this has been a walk in the park. This has been really hard, and I too am worried about the strain at particular points that it has placed on our teams.
Well, let me ask about that around the hotel quarantining. I guess the community relaxes a bit because there's no cases. They were all coming from overseas. We've had the shutdown. That's worked. Daniel Andrews has admitted at that time he scaled back his contact tracing team. Was that a period for you and Kerry, Chant and others to say, look, we need to worry about outbreaks, we need to scale things up, we need to work on when the next outbreak is?
I mean, the important thing to realise, Andrew, is that you can never be complacent, and you also have to assume the pandemic evolves and it's not static. The disease and the virus moves in different ways, and you're faced with different situations based on things outside your control. Our proximity to Victoria put us at serious risk. So you can never, until there's a vaccine, you can't rest on your laurels. But what you can do, which is what we're developing in New South Wales, is have a baseline for what is COVID safe. So until there's a vaccine, we know that everybody has to stay the 1.5 metres. Everybody has to get tested if they have symptoms and not leave the house and stay home for 14 days if they're asked to. Everybody has to have good hand hygiene. And if you're in particular settings, you should be wearing a mask. Now, these are the basics that we have to live with until there's a vaccine. So we can never rest on that. But can we push the borders or boundaries on other things if there's a change in the Victorian situation and a change in what we're experiencing in New South Wales? Well, that's an obvious yes, but now is not the time for that.
Do you look at Victoria and what happened there and say, how could this have gone so wrong?
Well, no, I think that could have been us if we hadn't managed things the way that we did. And one key learning for me...
But do you feel, why didn't they manage the things the way that we did?
Well, I know that as Premier, I rely on great people around me to do what they need to do, but I've also learnt to take the advice that I need to take, but also appreciate the integrated approach. And I think what we have to acknowledge, Andrew, which is what Kerry, Dr. Chant alluded to, is about a decade ago we did change the structure of our health system and have the local area health services, and that's helped us a lot. So Dr. Chant manages things centrally and gives that advice, but she's also got great people on the ground across every corner of the state who can support their efforts, and I think that structure has helped us during a pandemic. I also believe putting police in charge of our state emergency operations centres has really lifted the pressure off health. When police are managing logistics, including PPE, when they're managing a whole range of things health doesn't have to worry about, the health experts can do what they're trained to do, and that's the expert contact tracing, getting the community information out there, but also encouraging people to get tested, and results beget results, so the community gains confidence if the advice you're giving them is working and if they see a response to the advice. And they get confidence when they get their test result back in the palm of their hand in a certain time, and when the experience is less stressful than what it could be otherwise.
Well, you've had a couple of commentators say in the last couple of days that New South Wales is not the gold standard, as Scott Morrison says, that it's lucky. What do you say to that or think of that?
I've learned to ignore all commentary, good or bad, during this process. We have a job to do, and Dr. Chan and I and the teams that support all of us are really focused on that. I don't worry about the commentators, as you know. I don't really worry about that, but I know for a fact what works better than what doesn't. I know what we've learned, and you know, I don't like to accept the notion that we've had no mistakes or we won't make mistakes. We will. It's a pandemic. You're relying on people doing the right thing, whether it's the public or whether it's officials doing the right thing 24/7 every day, and that's a big ask.
Well, speaking of that, is there anything you learnt from the Ruby Princess saga, or did that harden your resolve to ensure that outbreaks didn't occur, that you could be on top as you can be of the pandemic?
I think what that taught us, in addition to other things, is it only takes a couple of cases to get out of control for there to be an issue. And we managed 12 or 13 cruise ships without a problem. And states had never had to manage borders before. I mean, we've been put in a situation where even managing quarantine, you know, I'm proud of the efforts, and the ADF has been really helpful, but the states have never had to manage quarantine. We've never had to manage the ports, whether it's air or sea. And we've
Should you have to?
Well, I think in a pandemic, it's all hands on deck, and the public want to know that all of us are working as hard as we can. Operationally, the states have capacity to manage things, but certainly in some areas we do need the support when it comes to managing our borders, and that's why the ADF and Border Force and others are involved.
Kerry, Chant, I've had 2 family members test COVID negative. Within 15 hours they got the text message, which is what you're talking about, the fast testing. That seems extraordinarily fast. How do you get results to people so quickly? What's the process?
So look, I just want to moderate the expectation of your listeners. We do the best we can, and on average we try and get the results on the same day. We recognise that to get people coming back for testing, we need to make sure that the customer experience is a positive one. And that goes from the way we communicate and how rapidly the test. So there's been a lot of effort put into that. And that's in part due to our New South Wales health pathology, and they've worked seamlessly with our local health districts to make sure that how the tests get collected, and then how it gets to the lab quickly enough, and then how we've introduced that SMS text messaging system.
We've got sort of between 5 and 20 new cases a day. Could we go on with this, or New South Wales go on with this for months and years? Is that just what you have to get used to, or could elimination happen? What's likely to happen?
Well, Andrew, that's the point. We have to live with a steady state of living with the pandemic, and that's why in New South Wales we think we have the right balance with having good economic activity whilst keeping the virus spread under control, and we're going to have to maintain this. And I think the biggest challenge for us will be fatigue. And we know the systems we have are really good, but we also know that a lot of people have been working under the pump for a long period of time. So we know that the systems we have are really sound. We're learning all the time, and that's, I think, a cultural issue as well. You never know everything. We're learning every day, every week. Dr. Chant,
this is a problem with state borders, isn't it? Because
Absolutely.
the other states are saying elimination. You're saying to me now you cannot have elimination.
Look at New Zealand. New Zealand shut down their economy twice or 3 times, and they're still getting cases. The other day I kind of looked in interest because New Zealand had as many cases as we had, and yet we're managing to keep our economy open. I can't understand. The Victorian situation is different, and that's exceptional. But I can't understand why any other state is precluding doing business or allowing relatives from New South Wales to go into their state. Our case numbers, touch wood, it's a moving feast, but our case numbers are manageable. Our economy is there to prop up the nation. Victoria's out of action. Normally New South Wales and Victoria subsidise the other states with GST, and they rely on our citizens consuming to be able to do that. But when you're limited to just literally your state borders, our citizens don't have those options, businesses don't.
Does the federal government need to intervene on state borders, go to the High Court, legislate, threaten to withdraw funding? Does it need to pull these levers?
That's a matter for them, and I think to the PM's credit, he has tried to allow each state to demonstrate their own way of moving forward within the Federation. But I think there comes to a point where the national economy is starting to really hurt, and it won't affect citizens necessarily in 3 months or 6 months, but can you imagine in a year's time if Queensland and WA don't open their borders, what will happen? I mean, I'm relieved that South Australia and the Northern Territory have been very positive and open-minded, and why anyone would preclude the ACT? The ACT hasn't had a single case.
So you think it can get to a point where there'll have to be federal intervention?
Well, I don't want to predict the future, and I can't see the likelihood of that happening in the short term. And that's not a matter for me, that's a matter for the Prime Minister.
Is it about elections for those states?
Look, I don't want to get into that. I've always tried to be respectful, but it gets to a point where they need to look closely at what it's doing to their own citizens. Their citizens at this point in time might be led to believe having 0 cases is fantastic and this is great, but in 6 months' time, when jobs go, when businesses fold, when tourism operators can't restart, when international flights are cancelled indefinitely, I mean, you're looking down the prism of economic chaos for their citizens, and I'm just asking people to take the medium and long-term view. And perhaps New South Wales has a different view. We're Australians as well as people who live in New South Wales, and we've tried to support the other states where we can, but I just don't understand the logic, given elimination we know does not work. Yes, we all have an aspiration of 0 community transmission, and Dr. Chant and I and our team have had that aspiration from the beginning. It's perhaps not achievable, but it's always our aspiration to try and get to 0 community transmissions. But you can live with a situation which isn't that number because you have to. And I remember back in March when we knew far less about the virus, I kept saying we will do everything we can to avoid a lockdown again. People want certainty. They want to know you're going to stay open. They want to know you're working your guts out to keep them safe, but also to stay open, because nothing is worse to business than lack of certainty. And that's why in New South Wales we've provided that certainty. Our borders are completely open to everybody except Victoria, and even in Victoria from last Friday we loosened very much what the border communities can do, because we have confidence in our system, we have confidence in our ability to deal with it. And I just wish that the other states would have the same level of confidence.
Kerry, Chant, what about a vaccine? Scott Morrison, Greg Hunt, they've spoken about it. They've seemed very optimistic this week about it. Are you that optimistic?
My optimism comes from the fact that the best and the brightest across the world are collaborating in a way that we haven't seen before. And there's a lot of concurrent activity to both manufacture and run the trials. But we do need to remember that we haven't had a vaccine against a coronavirus before. There are many processes like the phase 1, 2 and 3 trials that we need to run. And so whilst I have a degree of optimism because everyone is working so hard to find a solution, because this is the world's problem to deal with, I still have a caution that there may be some delay in us getting a vaccine. So I think we need to recognise COVID will be with us for a while, and I'm certainly looking, if I have to give my estimates, it won't be till the middle to end of 2021 in my view, but I keep an open mind and I would love a vaccine as soon as possible, a safe, effective vaccine as soon as possible.
And finally, Premier Berejiklian, you haven't always seen eye to eye with Scott Morrison over the bushfires.
I wouldn't say that.
Now he says you're the gold standard.
No,
how do you take that? What's your relationship with him right now?
I have a very constructive relationship with the PM, Andrew. They were your words, not mine. And secondly, we know this is a daily battle, and the situation can get out of control very quickly. And I'd like to think that in New South Wales we are struggling and working hard every day to get the balance right. Controlling the virus, but having as much economic certainty, positiveness, confidence as possible. And it's really important for me to send a message to all of our citizens in New South Wales that we're open for business, that so long as you stick to the health advice that we've provided, you can go about your daily life, your daily business. But all of us have to be on our guard. That's what living with a pandemic is. And if you looked at New South Wales as a separate jurisdiction and compared us to anywhere else in the world, I'm incredibly proud of what we've achieved. But I also know that that could go in a day or 2 days. If we got a strain of a case we didn't identify in time, in a large venue, that can all go overnight. So we are living by the seat of our pants every day. But our strategies are right. We have the right settings, the right systems, the right support. We've got everything going for us, but we can't ignore the fact that it's a daily battle and we have to keep working hard.
So you feel confident that you're in lockstep with the federal government, that you won't end up in a blame-shifting game, that the PM accepts mistakes can happen and that you'll move forward together to tackle the pandemic?
I think that's always been the position from day one. I think the PM's been very clear. He's said it on a number of occasions that mistakes will happen. None of us are perfect. And I want to preempt the mistakes that will happen in New South Wales because they will. And because you're relying on good people 24/7, including businesses, patrons. How easy is it to let your guard down when you see somebody you know? But in a pandemic, all of us have to exercise good focus and good discipline and have in the back of our mind every time we leave home that unfortunately until there's a vaccine, life is different for all of us.
Does that give you any sympathy for Daniel Andrews then?
Absolutely.
Given there have been so many mistakes down there.
Absolutely, it does. Look, we have a lot that we talk about. We share the most critical border in the nation. But we may also have a bit of a different philosophy in how we deal with situations, and that's evident. I'm more likely to have a robust, open economy, and that's certainly our position, and everybody would say that that's a philosophical difference. But there's a lot of others we have in common with the highly populous populations. We have populations that move around extensively within a large global city, so there's a lot that we have in common, and I have enormous empathy for him. That could have been me. If we hadn't managed our systems, if too many mistakes were made on a particular day, that's what I think every day. That's why I don't feel complacent for a second. Commentary goes either way, but at the end of the day, I know how contagious, how dangerous, how lethal this virus is. And even after 8 months, we don't know everything we need to know about it. It's evolving. But I do have the confidence that I've got the best Chief Medical Officer in the land sitting next to me. And I've got the best health system. I've got a great team of colleagues. But also, I can't go past recognising Service New South Wales, the police force who've been outstanding, and all of the 20 government agencies you see here, including ADF support we've received. And it's been that integrated whole of government approach which is allowing us to manage the pandemic but also do what we normally would do as a government.